the service, sorry, some of the services that Hawaii Ship provides. So Hawaii Ship basically we're comprised of volunteer counselors that are trained in providing assistance, information, and referrals for all Hawaii residents about Medicare. We also provide Medicare information at public presentations, fairs, and exhibits. And then these are our contact phone numbers. If you have a client or anyone else that needs assistance from Hawaii Ship. Next slide, please. Okay, so we're just gonna dive into a little bit of the data. So this is the data that we found that can provide a little bit of a background of home health care here in Hawaii. So number of Medicare beneficiaries with home health in Hawaii is 4,230 as of 2020. And the estimated home health expenditures in Hawaii is 48,331,268 as of 2020. And also the remaining two statistics that you see on the bottom, those are basically nationwide statistics. So nationally, 33.5% of home health users are between the ages of 75 to 84 years old as of 2018. And nationally, there is 61% of home health users that are female. So just a little bit of background and context about home health care. Okay, so what are my Medicare plan choices? So this chart provides you a quick overview of Medicare Part A, Part B, C, and D, as well as Medigap. So basically, an individual can have two choices. You can either have original Medicare, which includes the Part A, the Part B, the D, and the Medigap, or you can have a Medicare Advantage plan, also known as Part C. And then Part C plans are offered from companies like Kaiser, HMSA, United Healthcare, Humana, Aloha Care, WellCare by Ohana. And then of course, to qualify for Part C, you must already be enrolled in Medicare Part A and B in order to enroll into that plan. Next slide, please. So who is eligible? So if you have Medicare and are receiving services under the supervision of a doctor, you are eligible to receive home health care coverage. Basically, you need your physician to certify that you are in need of home health care as well. And then basically, so a healthcare professional certifies that you need one or more of the following intermittent skilled nursing care, physical therapy, speech language pathology, or continued occupational therapy. Next slide, please. And then, so how does Medicare pay for home health care coverage? So it's through Part A or Part B coverage. And then basically after you meet the Part B deductible, it is $0 for covered home health care services. And 20% of the Medicare approved amount for Medicare covered medical equipment. And basically it makes one payment for the covered services during a 30-day period. And then receiving care from a Medicare certified home health agency can reduce your out-of-pocket costs as well too. Next slide, please. So what is covered? So skilled nursing care. Skilled nursing care is basically services that you need that require the skills of a registered nurse or LPN, basically that are reasonable and necessary for the treatment of an illness or injury. And it's given on a part-time intermittent basis, which is fewer than 8 hours each day or 28 or fewer hours each week. And some of the examples of skilled nursing care can include giving IV drugs, certain injections, tube feedings, changing dressings, or teaching about prescription drugs or diabetes care. And then next slide, please. And then now I will turn it over to Joanne, who will touch a little bit more basis about what is covered.
Thanks very much, Sherry. So in addition to skilled nursing care, home health care also includes physical, occupational, and speech therapy services. And for these services to be considered reasonable and necessary, they have to be safe, specific, and effective for whatever treatment, whatever disorder or condition the person has. The amount, frequency, and duration of the service needs to be reasonable. You have to be able to, or the therapy is aimed to restore and improve the function affected by whatever the illness or injury, and that there's a skilled therapist who can actually establish a program and carry it out you need a skilled therapist. On the next slide, I want to mention a little bit of home health aid services. And Medicare will pay for part-time or intermittent home health care services. And this is personal care. If needed to maintain your health or treatment of the illness or the injury. So Medicare will not cover home health services unless you're getting some kind of skilled care in any of the areas covered, right? The nursing, the skilled nursing, the PT, the OT, or the speech. Next slide. Another area that home health care includes is the medical social services. And again, these are services to help the individual family cope with the social and emotional concerns that may interfere with the treatment or recovery. The same thing applies like with home health aid. You have to be getting skilled care in order for medical social services to be covered. Next slide. So medical supplies are also covered. These are dressings you need for wound, IV tubings, saline flushes. Those are covered as long as they're needed for the skilled care. Durable medical equipment also is covered. Usually that's an 80-20% coverage that the beneficiary is responsible for 20%. The DMEs will be exactly what it sounds. It's durable, meaning you can repeatedly use it. Wheelchair, hospital bed, IV poles, those kinds of things. And if needed, agency staff may arrange for a home equipment supplier to bring the items to you. And I think this is really important. We've had discussions within our own counseling group about, a beneficiary calls and says, I need to get a walker or a hospital bed. And it's not easy to find for a beneficiary to just call any kind of medical equipment company and says, I'd like to arrange this, because they all have to be participating with Medicare. So with the home health care agency, they usually have their own contracts with an medical equipment company, which is very helpful to the beneficiary. Next slide. So the kinds of things that are not covered is 24-a-day care, meals delivered to your home, homemaker services, shopping, cleaning, doing laundry, and then the custodial or personal care like bathing, dressing, help with going to the bathroom. Again, the custodial care is only covered if you are already receiving skilled care. Next slide. So some of the expectations that the patient family can expect is that the home health care agency should tell you how much of your likely bill that Medicare will cover. They should also tell you if there are some services that Medicare that are not covered by Medicare and how much these cost. The home health agency is responsible for meeting all your medical, nursing, rehab, social, and discharge planning needs. And they are required to conduct a comprehensive assessment of your care when you're first referred to the home health care agency. And the next slide, I'm gonna turn this over to Candace, who's going to do a little demo about how you can compare home health care agencies in our area.
Okay, so I'm gonna stop sharing this really quick. And I think this might be a helpful tool for you folks to get a general understanding of what is available in your area regarding home healthcare agencies. So we'll share a copy of the PowerPoint with you folks as well. And so Medicare.gov is a CMS official run website that we use. And they have a function where you can search for providers and hospitals. So you can see here, you can find doctors and clinicians, hospitals, nursing homes, home health services, hospice, inpatient rehab, long-term care, and dialysis facilities. So for this purpose of this presentation, we're going to compare home health services. So for example, you can type in a zip code and then specify what type of provider that you're looking for. And then we can do a search. So when I do the search, it will provide me with the different agencies' names and then their telephone numbers. And then it provides me with the quality rating and the patient survey rating. So if we click on here, for example, telephone number, office location, and then over here, it will tell you about the services that are offered. If the service is offered, it has a check mark and says yes. If not, it will be a no. I think this is a good tool to generally find what's available, but we do suggest that beneficiaries follow up with the agency to verify the information is correct. It's only as good as the last time it was updated. And I think sometimes things can go without being updated, and the agencies I found statewide are short-staffed because of the pandemic. And so a lot of them have adapted by kind of nixing some of the services that they offer because they don't have enough staff to support it. So I suggest calling, seeing if the agency is still in business, what services they offer, and verify that they do accept Medicare. Even though they're on this tool, we found that some agencies listed are not accepting Medicare. So just to verify that.
Do you know how frequently this is updated?
It's supposed to be updated annually. And so same caveat too, if you're using the other functions for nursing home facilities and hospice, please double check the information is correct. And then usually if we find out the information is incorrect, we report to our CMS partners that the information needs to be updated, and we provide that updated information.
And I didn't hear Kaiser mentioned. Is it different for Kaiser? Well, is there a Medicare Kaiser?
Yep, it's right here. Oh, for the Medicare Advantage plans?
Is there a Medicare Kaiser Advantage plan?
Yep.
Okay.
Yep. So Kaiser is one of the Medicare Advantage plans. They're an HMO model, and they also have a home health agency on Oahu.
All right. And then we had a question, homemaker services, if already receiving skilled care, can you get both?
In terms of homemaker services, can you elaborate on the types of tasks they would do?
Maybe it was home health services.
Maybe at the end we can
Yeah.
adjust the questions, and then we can maybe ask them to elaborate a little bit more.
Sure. Okay.
And then I'll turn it back to Tammy, and then she'll kind of talk to us more about home health care. So here we go.
And thank you, Kelly, for bringing up those questions. So if it's helpful, we can make this a more interactive dialogue. Happy to have me and my colleagues answer questions as we go along. I think we have the time. These slides here that I'm going through is more from a patient perspective. So what you see here on the home health agency checklist, this is a basic checklist that a patient can use when choosing a home health care agency when they need those types of services. Questions that they could ask themselves are things like, is this agency Medicare certified? What type of covered costs, what the services, and what type of costs can be expected? Is this agency known, recommended? Does it have a good reputation with people that I know in the medical area, with my healthcare professionals, social workers, and other people? Also making sure that the agency offers the healthcare services that they need in particular, and making sure that they have the qualified staff with the availability to start when they need and provide the amount of frequency and care that they need. And for contingency purposes, if there are emergencies, that the staff is available off hours, nights or weekends. And maybe going back to some of the things that Joanne reviewed on personal care services, and I think I think Randy might have had that question about the homemaker. If the agency offers things in the personal care area, just in case it's needed, activities of daily living, instrumental activities of daily living, things like bathing, dressing, cooking, maybe even transportation, those types of things. Okay, so that's a basic checklist. Next slide, Candice. All right, so once a patient selects a home health care agency, and again, Joanne touched upon some of these things, a patient can expect to have a staff member from the home health agency to come to their home to find out about their specific needs and ask questions about their health. They will go back and coordinate with that patient's healthcare professional, their team, and make sure that the plan of care, which I'll cover in the next, in a coming slide, that a plan of care is defined, and to keep the healthcare professional updated about patient's progress. And in order to get everything started, a healthcare's professional, their order, like a doctor, nurse, a healthcare professional's order needs to be put in order to start that whole process. Next slide, please. Thank you. So this plan of care, this is an important document for the home health care area. This plan of care is put together by both the healthcare provider, that team for a patient, and also the home health care agency. So the plan of care contains things such as the services that a patient needs, which healthcare professionals, who should give these services, the frequency of the visits for these services at a person's home, the type of medical equipment, durable medical equipment was mentioned earlier as example, and what type of goals the treatment, this home health care for the patient, what kind of goals, what kind of results are expected. And being that the plan of care is a living document, it is updated by the home health care agency, the team, as well as a healthcare professional team. It's updated as often as needed, but at least every 60 days. That's a requirement for Medicare. Next slide, please. Thank you. Also, this slide is really kind of good practice for patients. So for a home health care agency, once they have one, a checklist here would be making sure that the home health team, they're polite, they treat the patient and the family with respect, they explain, they clearly communicate what the plan of care is to the patient, as well as any family members that might be needed to be in the loop. Also to make sure that the plan of care or the services that are being given are adjusted as needed based on a patient's health status or physically or mentally. Also, the patient can expect the home health care agency to check their home and suggest any changes that might be beneficial to them from a healthcare perspective. They can also they should also put the patient and any family members that are necessary in the loop on making sure that they are all informed and adjusting to the plan of care plan as necessary. Respond quickly to requests. Also for contingency, in case of emergencies or in case there are concerns or issues that arise, making sure that the patient or the family members know what process to follow with the agency. And they can expect that the patient's privacy, their protected health information will be kept, private. Next slide, please, Candice. Okay, so these next couple slides are around Medicare rights and appeals. So in terms of the rights for the patient, if they're a Medicare patient receiving home health care, they have certain rights. The first one being that, they have a right to receive written notice from the agency before the care starts, be told in advance what the care services are being furnished, and how often it may change, and also, to be able to participate in that planning and treatment of services that they're receiving. They can also expect to have an estimate of Medicare costs, what Medicare will cover versus what the patient may need to cover. They can expect, of course, to have their personal health information kept private. From a communication perspective, I mentioned that Medicare, they should be aware of what Medicare is covering and what the patient may need to cover from a cost perspective. Oh, okay, thank you, Taryn. And if they do have complaints or issues or questions, they should be aware of what process to take. And from a hotline perspective, there is a home health hotline in each state, including Hawaii, that they can call in order to log issues or questions or complaints. Okay, next slide, please. All right, and this slide is focused on appeals. Typically in the home health care setting, appeals need to be done pretty quickly. So this is a fast appeal. This is a scenario where if a patient believes that their home health care services are ending too soon, they have a right to appeal that to that decision. So in that case, the home health agency will give a written notice to the patient called the Notice of Medicare Non-Coverage. There's certain time periods that need to be met to furnish these notices and to turn around appeal decisions. If the patient believes the care is ending too soon, the patient has an option to file an appeal with the Beneficiary and Family-Centered Care Quality Improvement Organization. It's a mouthful. It's the BFCC-QIO. That's in the Medicare world. Levanta, whose number is in the last chevron on the bottom there, they are a authorized Centers for Medicare and Medicaid Services contractor that covers the state of Hawaii for this type of appeal. So they would be contacted and they would have the responsibility of reviewing the appeal and seeing if that appeal should be, if the coverage should be extended further, or if the home health care services should end at that time. Okay, next slide, please. So this slide is a listing of what we felt might be some helpful resources. There are links, URL links for the home health care resources for Medicare in particular, specifically. The Medicare and You Handbook 2022, that's updated every year. That's a good resource. There's also a listing of the Social Security Administration phone numbers, the national line, as well as all the neighbor, the Hawaii lines, Hawaii offices. The Senior Medicare Patrol, SMP, there's a phone number there along with the URL, and the Hawaii Long-Term Care Ombudsman Program, phone number and the URL. Okay, next slide, please. All right, and so I think this is the end of the presentation here. So we wanted to thank you for sitting through the slides. What you see here is the State Health Insurance Assistance Program, the Oahu helpline, and the toll-free helpline that anybody can call into. And also there's a SHIP website that is there on this slide, and there's an option to submit your questions through a contact link on that website.
So I think we have a little bit more time. So if we wanted to, I can click on some of the publications that were linked in the PowerPoint, and then I can show it to you guys briefly, and you will have a copy of this as well. But we just tried to find the most helpful resources for you folks. So there's going to be 3 other links to resources. So I'll start to pull them up. It's basically the same information that was shared with you today, but a more elaborated version, not on slides. So one of them is from Medicare.gov, which is that site that I showed you folks. And then it breaks it up into home healthcare services, what that entails, and that was highlighted under each slide about the services, what it doesn't pay for, which we covered, who could be eligible for these services, who needs to be deemed that it's necessary by a healthcare provider. Some anticipated costs that we did cover in the presentation if you had original Medicare. The process for Medicare Advantage for home health care, the structure of Medicare Advantage plans is as good or better than, so it should cover the same benefits for home health care. The only difference with Medicare Advantage is maybe the process of obtaining the home health care. So always check with the MA plan first to decide what their process is and what their coverage is. It could vary depending on the Medicare Advantage plan itself. You want to make it larger. Is this helpful? Hopefully it's a little bit bigger for you folks. And the SHIP program does also work with the Medicaid population. What we do is with anybody who calls into our services, we do that initial income and asset screening for Medicaid, the Medicare Savings Program, and Extra Help. And then if they potentially qualify based on that initial screening, we can direct them to the applications. We can help them complete the applications. And we also work with the Catholic Charities Benefit Enrollment Center if they need one-on-one assistance completing Medicaid applications. And then on this resource, there's some notes here as well as things to know. So that's one of the resources. I'll pull up another one for you folks. So for the next one, it's going to be a PDF publication also found on Medicare.gov. And we also have this publication at our office. So if somebody wants a beneficiary wants this mailed to them, they can just call us and request that free mailing, and we can send them a book. So this one's a even more elaborated version of what was on the Medicare.gov. And we can see here on the table, it kind of just breaks it up. So another helpful resource for you folks. And then finally, I'll show you the Medicare Interactive. This is another CMS run website with similar information. The Medicare Interactive site has similar information to Medicare.gov, but I find it provides a different way of presenting the information, and it's more user-friendly so that if people need a elaborated version of what's said, they can read this as well. So all of these are linked in the helpful resources slide for you folks.